Jaram also, Arakpadadi is touched here and there. There are 3 big chapters in Ashtanga Hridayam. Jaram, 184 slokas. Kasam, 176. Rasayanam, 170. Probably Jaram is the biggest chapter. Probably they would have tried so many things and suffered to treat that condition at that time. If you read Vaishitya Ratnavali, 960 slokas are there for Jaram. Probably you would have suffered much more. Jaram is whole and complete. Tikta rasam, kevala vittam, tiktam, kafanuvanda vittam, kashayam, vadanubanda vittam, maduram. Kevala vittam, uduchyadi, kafanubanda vittam, arakpadadi, negrodadi, vadanubanda vittam, maduram, drakshadi, mridvigadi. So what I wanted to say, the best rasa for a atura is tikta. The best rasa for a swastha is madura. The chapter starts with tikta and ends with madura. Tiktam is amapajanam, kashayam is guru, maduram is guru. Chapter ends with maduram. Maduram is vadavitta samanam. Samanam and Rasayanam are one and same for Vadavitta. Because when Vadavitta Samana, I give Shatavari. When Vadavitta Samana Rasayana, he gives Pushmandam. Both are Madhura Snigdha in nature. So for Vadapitta, this is having Chalagunasi. So for Vadavitta, Madhuram is best. I will not keep you boring. You see how it is going to deliver today. Jaram contains all the avasthas of the whole Samhita. Amavastha, Paschimana avastha, Pakva avastha, Uttana avastha, Gambhira avastha, Ashigari avastha, Chiragari avastha, Antarvega avastha, Bagir Vega avastha, Sharira avastha, Manasa avastha, Prakriti avastha, Vikriti avastha, Prakrita avastha, Vaikrita avastha, Chaya Prabhava Prasamanastha, Lina avastha, Alpo Vidosho, Dushyade Labdha, Anyadamo Balam. 14 avasthas are told in Jaram. Langanam, Swedanam, Vachanam, Snehanam, Vamanam, Virejanam, Vasti, Daiva Vavasariya Chikissa, Vishnum Sahasra Murdhanam, Jarajara Vadim Vibhum, Manasiya Chikissa, Sattva Vajaya, everything is told. If you go to the Pandu, Pandu is Kafadushti in Rasadal. There are 2 Pandus, Charaka Pandu and Susruta Pandu. Both are entirely different. Vyayama Mamlam Lavanadi Madhyam Mridam Divasopnam Adiva Tishnam Nisheva Manasya Pradusha Raktam Dosha Tvacham. Susruda's Pandu is Rasa Pandu, nutritional anemia, where Kadurasam, Rasapajanam is given, Punarnavadi, Gomutra Hridegi, Ayachanduram. Whereas Pandu of Varpada and Charaka, Pitta Pradhani Dosheshu. So it is a Pitta Pandu, Vasa Guduchari, Tikta Rasam is selected, Dadimadi Gridam is selected, Drakshadi Rasayanam is selected, Kaudajatrapala is selected, Mahishi Kshiram is selected, Guduchi Swarasam is selected. That's the end of that chapter. So there are various Dhatu Dushti, Dhatu disturbance, Dhatu Vritti, Dhatu Kshayam, Dhatu Bhagam, Dhatu Dushti, Dhatu Shaitilyam, Dhatu Asamahatvam, Dhatu Astiratvam, Dhatu Vritti, obesity. Dhatu Vritti. Obese persons are coming, so many cases are coming. I want to reduce weight, I want hair growth. Which oil has produced hair growth? Except SKM oil, no oil has produced hair growth. So, these are all the areas, as long as the world exists, sexual medicine exists, hair growth medicine exists. Because people want that. Aharam, Nidra, Abrahmacharyam are Trayo Upastambhas. Agaram is the fuel demand produced by Pitta to sustain Pitta in the body. Please sit down. Manodharma Divan. Nidra is the fuel demand produced by Kapha to sustain Kapha in the body. Abrahmacharyam is the fuel demand produced by Vada to sustain Vada in the body. Among the 14 Vegas, 3 Vegas are Upastambhas. One day night, 2 o'clock, when I was getting the mood, not that mood of Charaka, I took Gray's Anatomy and draw all the, starting from Nidra, starting from Malam, Purisham to Nidra. 14 Vegas synchronized with the autonomic ganglion of the Gray's Anatomy. These Vegas you cannot stop it. Vegan Nadare, Udiranam, Gadimadam, Udiranam, Chanikraha, Sevanam, Sagadanam, Narinam, Adisevanam, Karmakala Vadasya, Mityaram Basya Karmanam, Vinayasara Bhujyasya, Lobhyanam, Adidarshanam, Prajnaparadam, Janiya, Sarvadosham, Prabhavan. So all the Vegas denotes sympathetic and parasympathetic pathway. Vadapitta denotes sympathetic activity, parasympathetic Kapha activity. We have done a study why people apply a hair oil in the head. We collected 24 hours urine, not for anything else but for study, to assess the adrenaline and cortisol present in that. People who apply oil, their sympathetic activity comes down. Adrenaline, cortisol secretion comes down. If you see the Pradimarsanasya, 15 Pradimarsha kalas are told. After eating, after sex, after vomiting, after sleeping, after eating. All these activities increases sympathetic activities and produce epinephrine, non-epinephrine, cortisol, dopamine and all these things. The Pradimarsanasya regulate that and control sympathetic activity. So coming back to the Jwara Chikitsa, this Prajnaparadam is the cause obesity. We told obesity. One person came to me, I told him, how can I reduce weight? I told him, you take a cup of oats in the night. Then he asked me, before food or after food? I told him, take both. I was coming in the flight, the air hostess asked, vegetarian or non-vegetarian? The fellow told both. She fell down. Then I told her, I was talking in Global Ayurveda Summit in Thiruvananthapuram. Minister was coming, Vice President was coming, I was sitting there, I was the keynote. Veganadare, I wanted to go to urine. Full police, Izzat police, tiger padai, kudurai padai. All with black cats, which is called cats, black cats. So I went in, who are you? He told. I told, I am a Vaidya. What do you want? I want to urinate. Why? Shastra says, na vegana dare. President is going to come. So what? My bladder doesn't know that. Then he told me, you come with me. Then 2 policemen with guns came. What are you going to do with the 2 guns? Then I was the first Ayurvedic doctor to urinate in the 3rd floor with 2 gunmen portrayed. It was a unique experience. So coming back to the obesity, in Maharashtra, Ganapati worship is more. Mooladhara Kshetra Sthitam. It is in the Mooladhara Chakra, Ganapati, Prathivi Bhudam. Gajananam Bhudaganadi Sevidam Kapitta Jambu Palasara Bhaktidam Umasudam Shoka Vinasa Karanam Namami Vigneshwara Padabandai. Wow. In Ganesha we give Kapittam and Jambu. Kapittam and Jambu, the glycemic index is 22 and 24, the two fruits that can be taken by obese people. Because obese people are ever pregnant and never deliver. See, even in Sloka, Naivedya, there is Ayurveda. Our country is called Bharata, Bhavam, Ragam, Talam, Bhavam, expression, Ragam, emotion, Talam, rhythm, lunged up, atrial fibrillation, Vada Pradhanya, Hridrodham, Ichha Sakti, Kriya Sakti, Jnana Sakti, Brahma, Shiva is in the centralized AC Himalayas, Vishnu, all these things, acceleration, brake and clutch. Test match is Kapha, one day is Pitta, T20 is Vayu. The world has become Vayu. Everybody wants Vayu. Everybody. In flight I was sitting. Before flight is landing, some fellows are getting. I told my Vada fellows. I was not getting. He asked, are you a Kapha fellow? So Vada Raktam, our body nature is Shida Snigdam Agneyam. Jaram is Shida Snigdam Agneyam. Shidam Snigdam Agneyam. How? Sivat Sakta Yukto Yadi Bhavati Sakta Prabhavidam. Men is Shida Snigdam, woman is Ushna Snigdam. That is why Magadi Garpa Vakranti, men Kshiram is given. Woman Masha is given. Ushna Snigdam, ovulation, Masridailam, Snagavanam, PCOD. Labu Kabi of their product. Labu Sabi, Labu Kabi, Aurangzeb, like that. So they give the product to men. During the first night, throughout India they carry milk only to the first night room. Because milk is a Gunasamanya to Shukra. Nakra Redaso Vrishyanam, Dravya Samanya. I don't know how to get it. Jamnagar, somebody tried and he lost his life. Gunasamanya is milk. Sangalpo Vrishyanam is Karma Samanya. In first night they carry milk and enter into the room. The man has studied Rasasastra. So MD Kai Chikitsa girl cannot take Taile, Takre, Gava, Mutre, Aranale, Kulataje into the first night. There is a logic. So everything, there is a Siddhanta. The Shida Snigdam Agneyam becomes Adishida Snigdam Shishira Rudu, Ushna Snigdam Vasanta Rudu, Ushna Ruksham Grishma Rudu, Shida Ruksham Varsha Rudu, Ushna Tishnam Sharad Rudu. Shida Snigdam Ama comes, you have what do you have? Jara. Ushna Snigdam, there are certain diseases of Raktapitta and all. After this viral fever, platelet comes down, Joram, next chapter is Raktapitta, viral fever, diarrhea, corona, diarrhea came, Joradisara in Chakradatta. The order is so beautiful. The order is so beautiful. Charaka states Nagabedam first, talks and comes to the Anavasti, the Chittatvam. So first chapter is on Achetana Nagam. Last one is bipolar personality, cyclothymic personality disorder. 29 disorders of neurological origin. Only one endocrinology, one pulmonology. That denotes the prevalence of Vada Vyadhi is more even at that time period. So, Ushna Tishnam Sharadrudu is Vada Rakta. The Chikitsa ends with Vada Rakta. All the autoimmune rheumatological spectrum comes under the umbrella of Vada Rakta. The Vada Rakta After Vadarakta, Labhopayogi Shastanam, Rasadinam Rasayanam is told. Doshadinam Rasayanam is not told because Dosha Chikitsa ends with Vadarakta. That is why most of the TNF alpha blockers, biological, infliximab, rituximab, whatever they invent for cancer, they go hand in hand with rheumatology. So my dear students, with that introduction, we will enter into the topic. Jadaragni digests the food. Jadaragni digests the food. In the absence of food, it digests the doshas, it digests the dadus and produces autoimmunity. Next. There are more than 80 diseases. Agni and Ama. I went as an examiner. I have never failed a student in my life. I asked him what is the main ingredient of Shavanaprasam. He told Shavana, Bale. I told 500 seeds should be removed. But not so, I will remove, sir. Main ingredient of Shavanaprasam is Shavana. Okay. The internal is restless because he is MLA's son. What is Agni? What is Amam? What is Prakriti? Student is not open. Then I asked him, who is father of nation? Rahul Gandhi. Then internal told, sir, half is correct. Gandhi, give him passport. Next. Ojo Visramsa, immunocompromised, diabetes. Ojo Vyapat, autoimmune. Ojo Kshayam, immunodeficiency. Dadu Vriddhi, obesity. Dadu Kshayam, Radhayakshma. Dadu Pagam, Ratabittam. Dadu Dushti, Grahani. Dadu Saidilyam, Pramegam. Dadu Asamahatvam, Shobham. Dadu Astiratvam, Unmadam. See? That is the beauty. When you say Vadavittam, Pittavadam, they are entirely different. Vadavittam is different, Pittavadam is different. Pitta Kafam is different, Kapavittam is different. Vada Kafam is different, Kapavadam is different. Vadavittam, gastritis. Pittavadam, vertigo. Pitta Kafam, herpes zoster. Kapavittam, eczema. Vada Kafam, LV dysfunction. Kapavadam, bronchial asthma. Vadavittam, Vidaryadi. Pittavadam, Drakshadi. Pitta Kafam, Guduchiyadi. Kapavittam, Arakodadi. Vada Kafam, Ashtavargam. Kapavadam, Dasamunadidare. See that? Jai. This is how you should teach. This is how the guna. Either you will become a genius or a mental, both are enjoyable. Next. Mandagni. Kapha based atherosclerotic problem. Tishnagni. Pitta based problem. Autoimmune. Vishamagni. Degenerative problem. Only these three problems exist. Next. Dosha Pakam is good. Dhatu Pakam is not good. Dhatu Pakam is the death, autoimmunity. Next. Kapha proteins. Malarubam is ketone and indoles. Pitta, arachidonic acid. Vada, disaccharides. Next. Dhatuagni Vriddhi causes Dhatu Kshaya. Dhatuagni Kshaya causes Dhatu Vriddhi. Next. Next. Dhatuagni ATP phase. Dhatu Vriddhi, metabolic syndrome. Obesity. Non-communicable disease. Big problem. Everybody is having PCOD. One day they wanted to take a scan for me. I told write anything, but don't write PCOD. Because you are writing for everybody. Dhatu Kshaya. Fatty liver, PCOD, Nabatean cyst. Every report it is there. Prostate problem. One fellow came from Nagaland to our Gurukulam. Studied for 3-4 years. Still he couldn't get the grip of Ayurveda. Sometimes it happens, We cannot convey a Tridoshic message to somebody. They will be so resistant. This fellow went to Nagaland and wrote a letter. Guruji, I am touched by your classes. You opened my heart. Kindly accept my salutations and prostrate to you. Prostrations. I told you, I accept your salutation. Keep your prostrate with you. You may need it in the future part of your life when you are married. This fellow again, Guruji, I want to start a Panchakarma clinic. Send me Virechana Yandra. I told, as far as I know, Sarana knows, there is no Yandra for Virechana, you have to just sit at all. No, I saw in your clinic, you should send. He sent 500 rupees money order. What to do? I bought a red bucket and sent it to him. The beauty is, telegram came. Thank you, Guruji. Highly useful. I don't know what he is doing. This fellow came to my clinic. Brass Vastinatra is there. He kept in his mouth. He told, I am a saxophone player. Oh, do you play? Madhyane Kinji Davarate. You come by 11 o'clock tomorrow, I will teach you how I play saxophone. 11 o'clock he came, 11:30 he vanished with his baggage. Next slide. Dadu Shaidile. Next slide. So, Dadugata Avastha is mentioned in Jora, Kushta, Vadarakta, Masurika. Wherever Dadugata Dosha is mentioned, their autoimmunity treatment is mentioned. Jaram, you contain treatment for autoimmunity in Pitta Jara. Jaram contains maximum yogas. Patya Pustambaradi, Vyagradi were studied for Corona. After teaching 182 slokas for Jara with commentaries for 6 months, I told the students, my dear students, I have taken Jara beautifully, but one is not told by Acharyas. You should know that. It is Tikta Rasa, Kadu Rasa, Ushna Virya, Kapavadagara, Amapachana, Jwaragara, Shulanasana. It is called paracetamol. Next slide. So, Rasakadam. Various immune diseases of Dadugada Avastha of Jara. Rasagada Jara, mixed connective tissue disorders. Rattagadam, SLE. Mamsagadam, polymyositis. Medogadam, type 1 diabetes mellitus. Insulin is kapha. Glucagon is pitta. Stomatostatin is vayu. Astigadam, osteomyelitis. Majjagadam, post-viral demyelination. That is why Majjagada Vishamajjara Chikitsa we apply in multiple sclerosis. Sukragadam, anti-sperm antibody. Next. Diseases, autoimmune, Dadugada Avastha of Kushta, Rasagada Kushtam, Ichthyosis, Raktagada Kushtam, Folliculitis, Mamsagada Kushtam, Furunculosis, Medogadam, Astigadam, Sukragadam, various stages of leprosy. Next. Various autoimmune diseases mentioned in Vadarakta. Rasagadam, mixed connective tissue disorder. Rattagadam, Felty syndrome, ITP. Mamsagadam, polymyositis. Medogadam, autoimmune thyroiditis. Astigadam, rheumatoid arthritis. My dear students, if you go to the Autoimmunity, Autoimmunity is the key opener of endocrinology in Ayurveda. Adi Sthulam, Adi Krisvam, Adi Romam, Aromam, Adi Dirgham, Adi Krisvam, Adi Krishnam, Adi Swedam, anterior pituitary, thyroid, adrenal cortex, testis, ovary, melanin. So, Adi Sthulam, Tistol, thyroid, Cushing syndrome, cortisol. Adi Krisvam, Addison's, told. Adi Dirgham, told. Dwarfism, told. Adi Romam, hirsutism, told. Aromam, hypogonadism, told. Adi Shvedam, albinism, told. Adi Krishnam, hyperpigmentation, told. Tell me one hormone missed by Charaka. Charaka is an endocrinologist. That is how I interpret. Next. Fimbicus vulgaris, plague. It is a Agni Visarpa, autoimmune. Next. So, Vada when it is in Tvak, neuropathy. Rakta, axonal neuropathy, erythema nodosum, pigmentation. Mamsa medogadam, tumors, fatigue syndrome. There is no kashayam in Vada Vyadi. There are only 2 kashayas mentioned in Vada Vyadi. Bhadradarvadi mentioned by Susruda in Akshepaka. Sagadaradi mentioned by Vapda in Urustamba. Urustamba is not a Vada Vyadi. Urustambam, legs are affected. After there is spontaneous recovery, the person is asked to swim against the current of water. The man with 0 power cannot walk. The man would have crossed 3+. The man would have crossed 3+ and he is walking against the current of water. So there is spontaneous recovery. Any spastic paraplegia, 2 things are affected. One is erection, another one is bladder. Erectile dysfunction and bladder control are not documented in Urustamba. Headache is documented. Vomiting is documented. Jwaram is documented. Nausea is documented. So Urustambam is arachnoiditis with patchy demyelination, sparing the S1 segment of the cord, which is spontaneous recovery, which is equal to AIDP, acute inflammatory demyelinating polyneuropathy. This is my conclusion. Right? Erection not told, bladder not told. Then what paraplegia? IVDP is not Urustambam, no Jara, Kada Equina, no Urustambam, TAO, no Urustambam, PVD, no Urustambam, Conus medullaris, no Urustambam, femoral artery occlusion, no Urustambam, diabetic motor neuropathy, no Urustambam, mononeuritis multiplex, no Urustambam, common peroneal palsy, no Urustambam, DVT, no Urustambam. They are all the spectrum in which Urustambam treatment can be applied. Femoral occlusion, Sagadaradi, Shakdaranam, Navagagugulu, Yeladi Churnam, Abhayarishtam, Vardhamana Vipari. Correct? Urustamba Chikitsa. Are they Urustambam? No, they are not Urustambam. Smoking produces TAO. Urustamba Chikitsa. One BAMS doctor was smoking, putting round and putting arrow in that, in a garden. Then Guru came. He was smoking. In front of Guru, Guru became the teacher of Rachanacharya, became very sad. I am MD Rachanacharya, what to do? I am so sorry. So he went and stood behind the tree and watching this BAMS fellow. Then his father came. He removed the cigarette and kept it back. Guru was very happy. Went to Shishya. Shishya, you are great. Mata, Pita, Guru, Daivam. Mata, then Pita, then Guru, then Daivam. Mata is a Daivam, Pita is a Daivam, Guru is a Daivam, Daivam is a Daivam. I am a MD Rasastra teaching you, you didn't respect me. You smoked in front of me. But when your father came, you respected and kept your cigarette back. I appreciate that. Then BMS Shishya told, no respect, sir. That fellow will ask the cigarette like that. These jokes I cannot control, In my class, full of jokes only. Students themselves will come and ask, sir, tell one that joke. No, that joke is not married. No, not possible. My child is studying final year. So no more non-vegetarian jokes. Next. Astigadavada, osteoporosis, Tiktarasena, Kshiragradada, Veshadam, Shukragadavada. Next. Rasagadam, chickenpox, hemolytic anemia. Vadabandu, leukemia spectrum. Pittabandu, hemolytic spectrum. Kaphabandu, nutritional spectrum. Vadagrahani, irritable bowel syndrome. Pittagrahani, Crohn's disease. Kaphagrahani, celiac disease. Pancreatitis, lactose intolerance. Vadagrahani, takram with chargiyadi. Pittagrahani, usiriyadi. Kaphagrahani, mustakaranjadi. Vilvadi guliga, chundai vattal churnam of SKM. Bragadi Pala. Bragadi Pala. They are making chundai vattal. Amazing medicine. Thair chundi churnam. Takrarishtam available in tablet form. Produced by SKM. Takrarishtam in tablet form. Next. Various autoimmune diseases of Kapha Rasam, metabolic syndrome, Raktam, nutritional anemia, Mamsam, tumors, Medogadam, obesity, Asti, fibrosis, Madhya, myelin dysplastic syndrome, Sukragadam, epididymal obstruction, Sukra Ashmari. Sukram will convert it into Ashmari. Who is allowing? Nobody is allowing. Sukram is wasted. So it is epididymitis is Sukra Ashmari. Reflux. So this metabolic syndrome, one person came from Italy. These Italians are very tall. He is 7 feet height and 4 feet long. They had some problem and some High Commission called me and to treat. So I made a big table from this length to that length. I asked that fellow, put Dobagu, Dvesaktini, Shirogrivam, Andaradi. 6 people there, 6 people here, 2 kilos one day for Udvartam. Oh Namo Bhagavate Vasudevaya. Amrita Kalasagastaya Sarvame Vinashanaya Sarvokina. Mahavishnave Swaha, 1.5 hour Udvartana. 21 days. He lost 10 kilos. But people who have done lost 15 kilos.
That's important.
Next. Rheumatoid and Vadarakta. Vadarakta comes in Sukumara, Pitta Prakriti. Veda Samhita says, Pitta Prakriti. Woman, next. Bhutva, remission and relapse. It affects knee, hips, shoulder, padayor, mulamataya. Divijana. Next. Swan neck deformity, buttonhole deformity, isthmus deformity, carpal tunnel syndrome, flexion of distal interphalangeal joint with hyperextension of proximal interphalangeal joint, swan neck. Flexion of proximal interphalangeal joint with hyperextension of distal interphalangeal joint, buttonhole. Isthmus deformity, Heberden node, Bachet's node, isthmus ulnar deviation, carpal tunnel syndrome, thinner wasting or the calm of the divinity is told, but our Shastra says, Damani Angili Sandinam Sangochaha Shidadvesho Anubasayo. Shidadvesho, if you dip your hand in water, it will become blue. Anubasayo, cold increases. Raynaud's phenomenon, SLE. Vadadiya Vadaraktam, Jogran, dry. Eye is dry, mouth is dry, my mind is dry, vagina is dry. Madhurarasam, Vadaraktakram. Vidaryadi, Dhanvandaram, Ksheerabala, Shavanaprasam, Ksheeravasti, Purnachandrodayam, Madhurarasam, Snigdha. Pitta Pradhanya Vadaraktam. SLE, mixed connective tissue disorder, crust syndrome, calcinosis, Raynaud's phenomenon, esophageal spasm, sclerodactyly, telangiectasia, scleroderma, pseudo-gout, pittam, tiktarasam, buduchadi, pachanamrudam, kaishwara gugulu, trivrithilegium virejanam, ksheeravasti, kogilaksham panam, trivrit milk virejanam, dhanyamaradara, SLE. Kapha-pradhanya vadaraktam, you are rheumatoid. There only Rasana is coming. There is no Rasana Dikashaya in Charaga. Rasana Vadagaranam, Yajna Purushiyam, one word. Rasanadi, Simhanada Guggulu, Ardhamatrika Vasti, Balladakam, Vadamana Bitpari. Vada Pitta, there is a rasa. Pitta Kapha, there is a rasa. Vada, there is a rasa. Pitta, there is a rasa. Kapha, there is a rasa. Vada Pitta, there is a rasa. Kapha Pitta, there is a rasa. Vada Kapha, there is no rasa. Most of the diseases what we see today are Vada Kapha in nature. Vada is Shidam, Kapha is Shidam, Ushna Chikitsa is needed. Bala is Vadagaram, Rasna is Vadagaram. Bala Madhurarasam, Madhura Vibhagam, Shida Viryam, Guru Snigdha Gunam, Vada Vitta Samanam. Bala Dadukshayavastha. Bala Yellamman. Bala Chronic. Bala Purana. Bala Chiragari. Rasna Tikta Kadarasam, Kadu Vibhagam, Mushna Viryam, Kapasamanam, Anubandha Vadasamanam. Kapanubandham, Rasna. Stula Degi, Rasna. Avaranam, Rasna. Acute, Rasna. Yellamman, Rasna. Ashigari, Rasna. Puranam, no Rasna. Ayurveda is Mula Siddhanta plus common sense. Common sense is called Yukti, which has become an endangered species. Next. Shulam, Swayadu, Ragam, Pushtam, Stabdada. Next. Mild fever, fatigue, clamam, Kledam and Abhishanti. All Ayurvedam is Kledam, Abhishanti, Dadubhagam, Malasanjayam, Kavarigunyam, Suradodushti. Ayurvedam over. That's all. Kledam, Ushna Snigdam, Kledam. Prakrita Kledam, Ashta Agara Parinamagara Bhavam. Vaikrita Kledam, Visarpam, Pushtam. Madhumekam. Abhishanti, Ushna Snigdam. Masham is Abhishanti. Uman is Abhishanti. Ushna Snigdam. Dilam is Abhishanti. Matsyam is Abhishanti. Dadi is Abhishanti. One fellow, one BAMS fellow went to Benares for entrance examination. He was going in boat. Previously, this fellow went to collect some Dravivana. Dravivana is very difficult, you know. One fellow went to the oral examination. He used to urinate in a place. See, in India, you can urinate anywhere, no? So, he urinated in one place. And unfortunately, an examiner from Jamnagar pulled that plant and kept it there. This fellow then came. Identify this plant. He was bold but no knowledge. He told, Mutra Pradeshya Sideshya. Every day some new things are coming. Maybe correct me. What is the family? Mutreshya. So this fellow went with the kudari to collect dravya. The kudari fell down in the water. Dharmadeva came. He showed silver kudari, gold kudari. No, I am BMS doctor, truthful. If Dharmadeva went in and came, silver kudari, no. Copper kudari, no. Then old wooden kudari. Yes, you are Dharmavan. You take all gold, silver, copper, wood, everything you take BMS because you are a truthful fellow. This fellow went to Benares University to write MD Salakya exam. He was with his wife. He was going in boat. Wife fell down into the Ganges. Dharmadeva came. Then he brought Nayandara. Who is the famous actress now? Huh? Nayandara. Nayandara Dharmadeva brought. Is it your wife? He told yes. Hey, Achetana Vastu, this is Chetana. No. First you will bring Nayandara, I will say no. Then you will bring Anu Agarwal, I will say no. Then you will bring Kushbu, I will say no. Then you will bring my old ugly wife, I will say yes. And you will give all the four. Already which one I am begging. If you give four, I will like it. What will I do? So BAMS doctors are very clever. I went to, in Madurai, I went to one doctor. He was having a big vessel. And he and his son are putting Desamularashtam from Kerala Pharmacy, Dudha Papeshwar, SKM, Sitaram, Vaityamus, Kotakal, and mixing. I was eating. I asked, sir, why are you mixing all the L.Mahadevan? Mahadevan, one fellow would have got agreement. Other fellow would not have got padala. Other fellow would not have got dundulam. So once I mix everything, I get original Dasamala. Next. Rheumatoid nodules, ulcerated nodules. Next. Anguli Vakrada, Arpudam, rheumatoid nodes seen in wrist, joint and sacrum. Stabdala, stiffness. Swasam, pulmonary fibrosis. Episcleritis, uveitis, thyroiditis, pulmonary fibrosis, aortic sclerosis, ulcerative colitis, Raynaud's phenomenon, extra-articular complications of RA. Jyati Swasa, Maha Swasa, Chinna Swasa, Tamaga Swasa, Pradamaga Swasa, Tamaga Swasa, Pradamaga Swasa, Sandamaga Swasa, Kshudra Swasa. Mahaswasa, acute respiratory distress, cortical. Chinna Swada, one eye will be retingular medullary. Ipsilateral palsy with contralateral hemiplegia due to brainstem injury. Tamaga Swasam, bronchial asthma. Pradamaga Swasam, bronchial asthma with respiratory symptoms. Santama asthma, bronchitis with the jora infection. Kshudra Swasa, hyperventilation. Manoswasa, psychological. Cortical, subcortical, respiratory, functional, psychological. See the beauty of unfolding of Kasa by Charaka. First Mahaswasa, Chinnaswasa, no treatment available because even now it is not treatable. Even now not treatable. Not treatable. Kasturi is not available, but Kasturi Gudivai is available.
How?
How? That's a secret. Next. See, Sandhisthanam is Vada gets vitiated by its karma. Vada is chala. It spreads through rectum. Rectum is vitiated by Vidahi Anna. Rectum is Sara. Pittanabandha. It circulates. Vadam circulate, rectum circulate. They go to Sandhi. Sandhi is Sida Snigdha. Shleshmadhara Kala. When Vada Ruksha dominates, you get osteoarthritis. Then Vidakta of Rakta mixed with Shleshmadhara Kala and Snigdha Kshaya Vidakta Vritti, you get rheumatoid. This is the Sampradaya. You are telling the man is going by a camel, Asti, Aswa, Vashtra. You have to change all these things. Many things should be changed. Next. Pulmonary fibrosis. Vadapradhanya Swasarogam. Fibrosis. Madhurarasam Kasagaram. Can you tell one Madhurarasam Kasagaram? Can you tell one Kasagara Ushada, madam? Huh? Vidaryadi. Nayobhayam. Purna Chandrodayam. Siddhobaladi. Yashtimadu, Kushmandam, Bala Lakshadi Dailam, Trivrithuti Kshiram. Do not select Tali Sabatradi, Dasamola Vatatriyam, Pippari, Asava, Arishtam, Yoshadi Vadagam, Chukkundippilyadi Guliga. Kasturiyadi Guliga you are writing, it contains Manoshila. Vayu Guliga you are writing, it contains Mercury. Chukkundippilyadi, you are writing, it contains Gauri Pashana. Will you give it to your child? Then why are you prescribing? Next. Vascular, Brahma. Hypertension, that's I will deviate. Next. Skin, gangrene, Bhavishyada Kushta Samam, Vadarakta. Vadarakta mimics skin disease, psoriatic arthropathy, scleroderma, Raynaud's phenomenon, pseudo-gout, Behçet's disease, Crust syndrome, Bhavishyada Kushtasamam. Bhavishyada Kushtasamam. It exactly is. Next. Gangrene, vasculitis. Next. Inflammatory, Vada Pitta Avastha. Next. Our life goes like this. Kapham, Kaphabittam, Pittam, Pittavadam, Vadam, death. Astigi, Jayade, Vardade, Viparinamade, Upasiyade, Nasyati. Kapam, stiffness. Kapavittam, stiffness with inflammation. Pittam, inflammation. Pittavadam, inflammation with degeneration. Vadam, degeneration with deformity. You should enjoy this Shastra. It's a pleasure. Nowadays students, they study. I select the worst students from the college. Rank holders I will not select. I go to the college, worst students, hopeless students, students who cannot study anything, whose brain is full of clay. I went to a college and asked, where is kidney? Kidney is between two legs. You come with me. Otherwise you is a danger to the society. You come. I will teach you. I will give you food, I will give you. One fellow came, another college I went. Sir, I have a problem for my father. Why? He is having severe itching in kidney. Itching in kidney. You come with me. Itching in kidney. I was sitting in a OPD. The 80-year-old man came. In Tamil Nadu, they think kidney is a scrotum. Education is little in my village. Or in my village. They think kidney is other one. The 80-year man came. 75-year-old lady is sitting there. I took urea creatinine, 80 creatinine 4. I told that lady, Pati, grandmother, your husband's kidney is not working. She got angry with me. Even 2 days before it worked well. Luckily, my wife went for sightseeing. Next slide. Next slide. Raktamokshanam, effective intermittent snehana. Mukta rakta viriktasya rikta goshtasya pushtina. Prabanjanas tadagyasya nasyad dega prabanjana. Samana snehavanam. 12 o'clock, 5 o'clock, 30 ml, 2 times a day. Vadaraktam comes under Madhyama Snehagavana, 5 days. Next. Leech. Still we are studying the names of leech. Kamala, Saindavi, Pushpu, male leech, female leech. When we are going to change all these items. Tamarada Vishilajit, Swarnada Vijilajit. 8 types of Haridagi. It is not available. Why do you teach? Why do you ask questions to students? All these things, I feel very sad that Ayurveda is going in this position. Next. But single-handedly, what can I do? I can only play Nalaswaram. Next. Alapu. Next. They are all fashion. Next. Next. Samprati. Next. Samyak prapnoli ityartaha. Doshahi nana vida dushti dushtena prakritava, vaikritava, anubandya rupova, anubandha rupova. Ekasova, Dushova, Trishova, Samastova, Anyesha, Bhavairva, Rukshadibigi, Doshavi, Vigalpane, Vigalpamana, Vigalpayanti, Vigara, Idi Sarva Vigara, Vigara, Bhava, Bhava, Pradivishesha, Abhinirvirtiki, Bhavanti Hedi Ityuttara. Samprati by Madhava, Nidana, Madhugosha commentary, by Vijayarakshita and Sriganda Datta. Up to Ashmari, Vijayarakshita wrote the commentary, then he died. Then Sriganda Datta completed Madhugosha in the name Shukti Mukta. The commentary is Shukti Mukta. We read all these things, sometimes they tell Mahadevan is so modern. So I got commentary, then they are happy. Medicine is not effective, that is why I am not bothered. Even if you tell a bad one Sanskrit, some people are happy. They are addicted to Sanskrit, not healing. Next. Next. Angiyade Urdhvam Gachadi Idi Agni. Among the Panchabhutas, Akasam is polluted. In ozone there is a leak. I have not seen. Vayu polluted, airborne disease. Water polluted, amoebiasis. Earth polluted, fertilizer. Agni is not polluted. If you touch, it will burn. If you touch, it will burn. Dharmavan. That is why Veda says, Agni Mile Purohidam. Agni starts with Agni. Tam Agni Varnam Tapasa Jvalantim Vairojanim Karma Pareshu Duttam Durgam Devigam Saranamagam Pravatye Sudarasarase Namaha Agni Tumparaya Navyo Durga Sutta Agni Angiyade Urdum Gachadi Agni Urduredam Durubaksham Vishurubaya Vainamaha Vishurubaya Vainamaha Om Namahiri. Next. Samyak Prapnodi Ityartaha. Next. Next. 600 slides are there, I don't know. Next. Vadadigam, ankylosis, contracture, Pittadigam, tenderness, Kaphadigam, stiffness. Next. HB will be low, ESR will be high, RA may be or may not be positive, anti-CCP, 86% accuracy, which can inform deformity, CRP positive, 8% of RA, ANA will be positive, you should do dsDNA, ferritin will be high in inflammatory disease like cirrhosis, Crohn's disease. Next. Koshtaka Sirisham, acute synovitis. Next. Amavadam, Rasadushti, no deformities, Trigashulam, Kirdravam. Amavadam is not told by Brigatrais. The Amavadam is first used by word Ashtanga Sangraha in Dasamula Haridagi Palasudi. In Dasamula Haridagi Palasudi, the word Amavadam is coming first time in Ashtanga. Next. Vadarakta, previous one. Vada Pradanya Vadarakta. Sadavari, Jinnarupadi, Brigatyadi, Bala Sadavariadi, Drakshadi, Madhusni Kshira Kashayam, Shavanaprasam. When I was a student in Venkatramana Ayurveda College, nothing was there, toilet was not there, principal was not there, professor was not there, book was not there. Nothing is there, but dragging was there. Dragging. Madras bus will come, they will ask, stop it. Sir, will this bus go to Dubai? I have to ask. What they will think, Dubai, Madras bus. My roommate, my mother is a Vaidya. My mother makes very good Savanaprasam and send it to me by bus. My roommate take a bread, apply Savanaprasam, cover it with another bread, one bottle over, 2 bottle over, 3 bottle over. I was sitting. He will not give keta, he will drag. So 5 Savanaprasam over. He started vomiting. Akamadat Sardayari. He started vomiting. Then I took his urine to Madras Medical College. They take 10,000 urine samples every day. I gave this urine of my roommate. Result came in the evening. Pregnant. That is not a problem. I was the roommate. Ayurvedic jokes. Next. Puduchiyadi Ganam, Brigatyadi Ganam, Kokilaksham Ganam, Kushmandam Ganam, Vidaryadi Lekyam. Next. All Madhura Snigdha. Next. Mahadiktagam Snehavanam. Diktagam, Mahadiktagam Sneha. Diktagam, whatever is told in Diktaga is there in Mahadiktaga. 50% of Mahadiktaga is Amalagi. Diktagam, Puragarmam. Mahadiktagam, Samanagarmam. That is the difference. The word Dikta, if it is a Shodhana Dikta, it is Kadugarovni. If it is Samana Dikta, it is Bhunimam. Shodhana Dikta, Samana Dikta. Next. Only 3 Gukulus are Pitta Samana in nature. Gokshuradi, Kaishoram, Amridadi. All other Gukulus are Vadakava in nature. 50% of the Kaishora Gukulu is Guduji. 30% is Trivil. It is a Pitta Samana Rechana Gukulu. Whereas Simhanadam, Mahasimhanadam, Yogarajam, Mahayogarajam, this contains Abragam, that contains Nagam, Mangam, Yasadam, Abragam, Yagaguna Sinduram, Palasruti Visesham is there for Maha Yogaraju. It can be given in Pumsavana. It can be given for male infertility. It can be given for rat poison. Our Ayurvedic students, they don't have any patients in the college. Nobody is there. They themselves vomit, they themselves purge. No patients. Many colleges in Maharashtra and Karnataka, sorry to say, you are only spoiling Ayurveda. Why do you need these many colleges? Any fool is opening on college. That is not a story. That is, they are taking care sheet. I am the examiner. Ask question. Do you have diabetes? No. Father had diabetes, mother? No. Hypertension? No. Father had? No. Mother had? No. Why are you here? 5 years, married, no child. Whether your father had a child? Huh? If father and mother are infertile, children also will be infertile. Conclusion. Everybody. BAMS normal. One fellow written. Bowel, appetite, maturation, sex. Normal. Next. Kshira Baladailam. Narayani means Sadavari. Narayani is a Pitta Samanadailam. Baladailam is a Pitta Samanadailam. Madhushtiyadi is a Pitta Samanadailam. Next. Sukumara Erandam. Sukumara Erandam. Kadigraham Pumsavaram. Nirkundi Erandam. Gridrasi. Nimbamrada Erandam. Vadaraktam. Puvandu Sagadevi Erandam. Jwaram. Hingutrigunam. Gulma. If you see Gulma Chikisa, Ashtachurnam, Chardula Churnam, Naraja Churnam, Bhaskara Lavanam, Hingutrigunam, Lashuna Kshira Kashayam, Dandi Garidagi, Balladaga Gridam, Agadaksharam, Agada Uttu. This is the order. In Ashtangadhyam. Harrison. Their indication. Simple gas, non-ulcer dyspepsia, ulcer dyspepsia, duodenal ulcer, small intestinal polyps, small intestinal cancer, spastic colon, cancer large intestine, metastasis large intestine. See the video? Kapajana rogastina vibandasti kasana, balladagam, they didn't write first, they write ashtachurna. Balladagam comes in the last. Vada kapha visesha, you read Gulma. That's why I take classes Grahani. Grahani. I take first Grahani first. Then I take Prameya. Because Trivida Balam, Balam Tasyagi Vidbalam, Vada Balam, Radhekshma. Agni Mule Balam Pumsa, Pitta Balam, Grahani. Pragradastu Balam Sleshma, Prameya. Sagajam Kalajam Yuktijam Maketa. Next. Then Vasti. Niruga Vasti. Balaguduchiari Vasti. Very good for Pitta. Vada Kapha, Ardhamatrika Vasti. Pitta, Kshira Vasti. One fellow went to Guru. Guruji, Ayurveda Guruji. Namaste, namaste. Why are they adding honey to Vamana Dravyas? Guru is not well read. See, Vamana Dravyas are highly bitter in taste. Then why do they add honey in Vasti? The Guru will know. Somebody is laughing now. Sometimes they laugh after 20 minutes. Come on. Next. Suddenly, when you are taking lunch, what happened? You joke. Vada fellow, I used to go with my wife to shops. One fellow took white shirt. Then I told my wife, this Pragrata Kapha is in Rasastaru, in Pragrata Avastha, that is why he took white shirt. Another fellow took yellow shirt. Pragrata Pitta is in Pragrata Avastha, in Raktataru. Okay. Another fellow came and took crocodile underwear. I told he is a Vada. Why? Why do you need a crocodile there? It will bite you. Next. One fellow told Nakara Redaso Vrishana, not available. At least you wear crocodile underwear. Rasa, Vadana, Madhura Rasa, Kshira Kashaya, Bagir Parimarjana, Dara, Chira Dara, Dara, Shiro Dara produce alpha wave coherence, restful alertness. Dara. We see EEG changes. In EEG you have three waves. The frontal lobe is Vada, temporoparietal lobe is Kapha, occipital lobe is Pitta. Vagartha Sambrutto, Vagartha Pradipattiye, Jagadapidaro, Vande, Parvati, Parameswaro. Walk, Broca's area, area number 4. Artham, Wernicke's area number 21. Shiva and Shakti. Able to convey Broca's. Able to understand Wernicke's. Motor aphasia, sensory aphasia. Now coming to this, Kshirayukta Virejanam Rasayanam. Next. Kashayam. Amrudottaram. Amruda Vadaraktakanam. Shunti Amavadanam. Hariragi Virejanam. Kogilaksham Guduchari Sadavari Chinnarukwadi. Next. Amruda Uchiradi. Very important Kashayam. Pachana Amrudam. Bala Guduchari. Only 3. Bala Guduchi Devadaru. In EG, inhibitory waves Kapha, excitatory waves Pitta, modulatory waves Vayu, modulatory waves tonic-clonic epilepsy, excitatory waves temporal lobe epilepsy, inhibitory waves petit mal epilepsy, Jacksonian epilepsy, complex partial seizures, Vada epilepsy, Kalyanaka Gridam, Jeevaniya Kashayam, Pitta epilepsy, Ashtadasha Kushmanda Gridam, Mustadi Radayavana Vasti, Arigala Dailam, Kshiravalla Dailam, Kapaja epilepsy, Panchagavyam, Vacha, Lasuna, Rudraksham, Pippali, Jyotishmati, Yelam, Indravarani, Kadurasam Medyam, Medyam, Vadapitta Samanam Medyam, Kapapitta Samanam Medyam, Vadapitta Samanam Medyam, Maduram, Kapapitta Samanam Medyam, Tiktam. Medya Dravyas comes under Tiksaskanda. Vadapitta Samanam Medyam, Yashtimadu. Pitta Kafanam Samanam Medyam, Guduchi. Vadapitta Samanam Medyam, multi-infant dementia. Pitta Samanam Medyam, white matter degeneration. Kapha Samanam Medyam, Lewy body dementia. Vada Samanam, Alzheimer's. Triphala Chakshusham, Haridagi, Kapha Samanam Chakshusham, glaucoma. Amalagi, Pitta Samanam Chakshusham, diabetic retinopathy. Vibhidaki, Vata Samanam Chakshusham, macular degeneration. Everything is available as a book. You all buy and help me. Not that. All the money I am paying fees of 15 students every year from the money I get. Single paisa I don't take. 15 students, around 20 lakhs, I pay fees. But they don't study. They don't study. Where is kidney? Same case. Next. Shaddarana Vadi. Palasya Dasamo Bhagava Dharanam. Gokshurari. Guduchi Sattvam. My dear students, I am going to tell you a sad news. Ayurveda produces hepatotoxicity. All the hepatotoxicities are documented in women, not in men. Only autoimmune cases, no disc cases, no Pakshagada cases. OTPT increases. Herbal, immune modulated autoimmune response. With the help of hepatologist, I did anti-smooth muscle antibody, anti-LKM antibody, IgG, anti-mitochondrial antibody, ANA, dsDNA, ANA profile. Many cases it is anti-smooth muscle antibody, they respond to steroids. Sometimes it goes to liver failure. You see all those cases. The reason, biopsy says, no such reason is found. They call it drug-induced hepatotoxicity. I was against that, but I see it's the time we should understand the adverse effect, because raw drugs are adulterated, contamination. We believe in the company. We don't make medicine. Lead toxicity. They criticize us. It is a time we should correct. Otherwise, after 20 years, the younger generation who study Ayurveda has to study some MBA or computer to get a job. I am settled. My life is okay. It will not happen to everybody. So don't compare myself. That's why when students say, I want to study Ayurveda, think 2 times, 3 times. Check the college, whether patients are coming. Don't pay this much money for Ayurveda. You will not get a job. This also we have to talk. That merit also we have. Both we have to talk. From Majja to Shukram is coming. One day they will ask how. Time has come. Certain things we cannot explain to modern people. Dadi is the yoni. Gridam is the dravya. Takram is from the grida. One is snigdha. One is ruksha. Gridam antidote is takram. Tilam is the yoni. Thailam is derived. Punyagam is derived. Thailam is snigdha. Punyagam is ruksha. Punyagam is the antidote for Thailasnagavana. This will you, or allopathy doctor, when you go and tell, we will not understand what you do. Don't go near. You sit yourself. Ayurvedic medicines are not effective, one fellow told him. It's okay, sir. What can we tell? In spite of all the criticism, they are growing. I have seen 7 lakh cases in my life. When they come, I can tell. It is not Siddhi. Guru Kripa. Next. Guduchiyadi Kashayam Sadavari Tiktaram. Next. Pitta Samana. Kafam already I told. Rasna Erandali. Rasna Saptakam. Vada Kafagaram. Triga Viseshatvam. Ushna Vidyam. Rasna Erandali. Vada Kafagaram. Ushnam. Kafapradhanya Vada Rakta Viseshatvam. Sugumaram. Vada Kafagaram. Ushnam. Mutramarga Viseshatvam. Saptasaram, Vada Kafagaram, Ushnam, Yoni Viseshatvam, Maharasnadi, Vada Kafagaram, Pakshagada Viseshatvam, Ushnam, Siravilvadi, Vada Kafagaram, Ushnam, Arsho Viseshatvam, Kandaravastadi, Vada Kafagaram, Ushnam, Apana Koshta Viseshatvam, Prakshevam, Lavanam, Gudam, below umbilicus, Lavanam. Amlena Saka Samyuktaha, Sadishna Lavana Rasaga, Madhuriyam Bhajane Atyartam, Krishna Bhavam Munjadi. Below navel, Gudam, Srishta Vilmutratvam, for Malabandam, Gudam, for acidity, Lavan. So all for Vada Kapha, Vada Pitta, Vada Pradhanya, Vada Pitta, Drakshadi, Pitta Samana, not Vada Hara, Mritvihadi, Pitta Samana, not Vada Hara, Vidaryadi, Vada Pitta Samana. Dhanvantaram, Vadapitta Samana. Vidaryadi, Dhanvantaram. Madhurarasam, Madhuravivagam, Sidaviryam, Purusnigdagunam. Vidaryadi, Palasruti, Abonabi. Dhanvantaram, Palasruti, below Nabi. Sthanam means receptor. That is why Dosha Pratinigam, Vyadi Pratinigam, Ubaya Pratinigam, Mukhya Dravya Viseshatvam, Sthana Viseshatvam, Prakarana Viseshatvam you should see. Now rheumatoid over. Then SLE. SLE is a disease. Next. What today? Next. Vasti. Next. Kshiravasti. Next. Whether to add Lavanam in Kshiravasti, Arunadevta says yes. Chakradatta says no, but I don't add. Next. Sadavari Chinna Rukwali. Madhura Tikta Rasa. Sidavi. Padaraktakyam. Next. Bala Sadavaryadi, Ashtanga Hridayam, Madhura Rasa, Pitta Samana, Pitta Pradhanya Vadarakta, SLE. Next. Amruta Ushiradi, very famous. Pachana Amrutam, very famous. Rheumatoid arthritis, first stage, gout to first stage. Wonderful medicine. What SKM is making, I think. If you tell, they will make definitely. Tikta Kadu. Next. Bala Guduchiyadi, Bala Guduchi Devadalu. Simple. Pitta Kapha Vadaraktam. Next. Vajraga Gridam, Tikta Rasam, Pitta Samanam, Kushta Jikisa. Next. Given in scleroderma. Next. Mahapindalenam. Pindam means solid. According to Kairali Vyakyanam, Pindam means Sarjarasam. Maltu Vellai, Demda Subramania Sastri's book, it is there. Maha Pindadelam contains Yarandamulam and Eshtimadu. Next. Bala Chinna Rukwadi, Attanga Hridayam, Padavyadi, last sloka. In Manoroga, Apasmaram, Unmalam, Adatwabhinivesham, Balagragam, not even a single Kashayam is mentioned. Only 23 Gridas are mentioned. Now people say anything which is fat soluble alone can cross blood-brain barrier. Our acharyas did not know that. They used grida. Not even a single kashayam is told in Manovyadi. The first kashayam is Brahmi Drakshadi. Brahmi Drakshadi is told in Sakasra Yoga. Sakasra Yoga is written in 14th century. See, like that you have to teach Kundamunda Lakshanam. If you start, they will. Many people sleep in the class, especially afternoon. Salakya Mandalde, Yashasastra, Agadadandra. In Agadadandra department, one snake escaped Mahasarpa. It tied around the HOD. One fellow is running right, one fellow is running to police station, one fellow is running to fire station, one fellow is searching for knife. The snake, Maha poison snake, bite the HOD. Everybody is crying. After 10 minutes, snake died. HOD is more poisonous. This is HOD. So this HOD, Guru, he was sitting. Shishya is sitting. The Guru is sleeping on the lap of the student. Right. I don't sleep with any student. I don't do that. This slaying, then two Vrikshikas escaped from Agadandra department. One Vrikshika is most powerful, son of Vishwamitra. He told, if you see, everybody will urinate, fully poisonous. The other scorpion told, hey, you go and bite that BAMS fellow. Then he took some pranayama, he took some Shanaprasa, Vishavilwadi, Neeli, Garadakudi and all. Bit at the thigh of the BAMS doctor. Guru is sleeping. First bite. No. Second bite. No. Third bite. Only water came. Ice. Crying. This is scorpion died. Other scorpion died. Yeah, you are telling you are a big fellow. That fellow is simply sitting. You tell even lords and devatas are afraid of you. This ego was stimulated. Again he went round and left leg. Bite 1, bite 2, bite 3. BAMS studying from Maharashtra is sitting there. Then he says, Scorpion very tired. Vaidya Raja Namaskubhyam, Yamaraja Sahodra. Vaidya, get up. I am the most poisonous snake, the scorpion in the world. When I see people urinate, some people defecate, some people fell down. I gave 6 bites, but you are simply sitting. Am I not painful? Then he opened BAMS. Yes, you are painful. I want to cry. I want to shout. I want to produce warm urination. I want to defecate. If I cry, my guru will get up. When he gets up, he will start Padartha Vijnana. Water, please. Now only I got mood.
Yeah.
Now only class started. 650 slides. I will give it to Birlaji. All of you learn and get liberated. Shravana matrena mukti. How do you know I expected lemon? Amlam Hridyana. This I will take later. Bala Chinna Rukvari Dailam. Next. Aranaladi Dailam. Next. Pitta Samanam. Next. Amurdadi Dailam. Pitta Samanam. Next. Jadamayadi Dailam. Bala Guduchiadi Keram. Jada means Jadamansi. Amaya means Kotta, Kushta. Pitta Samanam. Next. Vada Kafam. Kottam Jukkadi. Kola Gulattadi. Gragadumadi. Nagaradi. Yaranda Bijam. Sadakvadi. Lepas. Pitta Samanam. Guduchi Patradi, Karutta Vatti, Krishnadi Gudiya, Yellun Nishadi. That's all. Chapter over. Vada Samanam, Kottan Jukkadi, Vishagarbham, Vishamushti. Vadasamanam, Brahmanam, Mahamashatailam. Sidaviryam, Vadasamanam, Bala Guduchyadi. Sida Brahmanam, Madhuvishtyadi, Narayanam, Mahanarayanam. Samashidoshtam, Dhanvantaram. So many medicines conflict. These many medicines are not needed. Companies and all these things are there, no? Seminars we are conducting. 30 medicines are enough. 30 medicines are. First medicine is for Rogi. Second medicine is for Rogi's wife. Third and fourth medicine is for your family welfare. It should not be like that. It should not be. Next. Ellu Nishadi. Ellu means Tila. Next. Sparshashidam Antarushtam. Kshiravasti. Pittavadam Kshiravasti. Ardhamatrikavasti. Kapavadam Ardhamatrikavasti. Chakradatta Vadarakta Prakarna. I think meals has started. Everybody is going there. Next. Amrudotram. Then Kapapradanya Vadaraktam. Rasna Yarandadi, Maharasnadi, Rasna Saptakam, Rasna Panchakam, Rasna Sundhyati, Amrudotram. Next. 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 Panchasamachurnama Sarangatatamida. The word Amavadam is mentioned. Next. Yogarajam, Mahayogarajam. Already I told. Next. 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 Gukkuliriktaka Gridam contains Balladagam. Balladagam Ushnajalam contraindicated. Gukkuliriktagam, Bhavishalam, Kangayanam, Saptasamaguliga, Narasimha Rasayanam, Balladagam, Shida Jalanubanam, no Ushnajala. Many people are not adding Balladaga. Whether they have added, can you put our head in and see? No. Cannot see. Once I was giving Vasti 20 years back, hand was not going. I asked the student to bring the stethoscope. He was having dextrocardia inversus totalis. So I did Vasti in the right lateral position, did barium minima and documented. It is seen in my book. So right lateral, I always tell the students, always put your hand before the Vasti. If you hesitate to put your hand, then you may have to put your head into that. Gandhaga Rasayanam, Panchamulasya Dhatri Va, Raso, Leri Vajivasan. The Gandhaga. Next. Kottalikadi Jinja, you know. Next. Many people mix medicines. Mixing denotes uncertainty. Next. Otherwise, you can call synergy, Samudaya Prabhava. Next. SLE can affect any part of the body. SLE can produce abortion, Pittadiga Vadaraktam, anti-phospholipid syndrome, anti-cardiolipin syndrome, Putrakni Yoni Vabat. There is a medicine in Ayurveda, Prajastavanaganam, Vasti, Kshiravagam, Kalkam. Next. Pittapradhanya Vadaraktam, Uddana Vadaraktam. Next. Arthralgia, young woman, low platelet, low WBC, low hemoglobin, pain in joint, no deformity, history of abortion, evening fever, rash in the face, SLE. When SLE comes, protect the kidney, lupus nephritis, lupus psychosis, lupus vasculitis, lupus induced abortion. So, Pitta Samanam, Vadaraktaknam, Tiktarasam, Pajanamurdam, Kaishora Guggulu, Tiktagagradam Snagavanam, Virejana Snagayuktegi, Guduchyadigana Kshiravasti, Shavanaprasa. So SLE, over. Next. Next. Butterfly ray crashes and all. In India you cannot see. Next. Pain, arthritis, aches, high fever. Next. ANA will be positive. dsDNA will be positive. ANA profile, something will be positive. Beta 2 glycoprotein type 1, type 2 will be positive. Direct Coombs test to rule out hemolytic anemia is needed. Lupus anticoagulant is needed. Anti-phospholipid antibody IgM IgA. Anti-cardiolipin antibody IgM IgA. smear, ferritin, ultrasound to see the size of spleen. These are all the investigations needed. Rule out pericarditis, pleural effusion, lupus fever. We can treat 1.5 years it will take. I have treated many cases. 1.5 years. After hearing this, many people run away. Next, I gave Sudarsana Churnam, Shakdaranam to one person. I made ask him to give Shita Kashayam. Then he brought everything. Why? I will suffer with fever, sir. How can you take this? Very bitter. One fellow I gave Pudadavalation. He was sitting next day. He came. Why did you come? Wait. He opened the bottle, took a spoon from the bag, took one spoon. What are you doing? Sir, first you take. If you can take, I can take. Then after he went, I took a little bit. I tell you, miserable. So palatability, we have to consider. Okay. But how do people change? Computer world. Next. SLE. Next. Hair loss in SLE. Next. People come with the hair loss. We will tell, don't apply in the hand. Apply with cotton. Why? If you apply in the hand, hair will grow in the hand. Next. Lupus, pleural effusion, pleurisy. Next. I tell joke always. My clinic is full of jokes. One old man came. I told, lie down. He lie down on my lap. Hey, everybody, get up. My wife is coming, get up. All this kind of. One day I was going rounds. One lady had leukorrhea. I was a young boy. I told my Sishyas, Panchavalkala Dailam, Pichu, Kashaya Rasam, Stambana. Okay. Next day I am coming, she is having Pichu in the head. Huh? Okay. How do you feel now? She told, it is completely stopped. Huh? Then Sisha asked me, sir, how it is? What should I tell? I don't know what. But I had ego. I wanted to prove I know. See, this Sravam is controlled by Avana. Avanam is controlled by Samana. Samanam is controlled by Vyana. Vyanam is controlled by Udana. Udana is controlled by Prana. Once you treat Prana, Seshani cha Vadasthanani Tatyamutaneva Anukarana. Oh! After I went, Sisha told, mental fellow. Mental fellow. Next, pleural effusion. Next, pulmonary hemorrhage. Next, all complications. You should be. I am successful and liked by people not because I am thorough in Ayurveda, because I have studied Harrison, Davidson and Adams.
Yes.
That is why I am liked by all. If I have studied and telling sloga, I will be in Kanyakumari, watching the sea and telling slogas. Next. Pulmonary hypertension. Vada kapha shogam. Punarnavadi arishtam. Punarnava is 50 grams. Draksha is 8 grams. 8 kilos. It is Madhurarasa Shofagna. Madhuram cannot be given in Shofa. It is given for Vada Shobha. Many people contain Punarnavasam, Punarnavadi. Wrong. Punarnavasam, Madhurarasam, Shobhagnam. Madhurarasam, Shobhagnam, where will you give? Right heart failure. See? Can you give in nephrotic syndrome? No. Kapha Shobham, Madhuram, Tilakavardhanam. Sir, when should I stop, sir? Continue. Okay. Next. Cognitive impairment. Memory loss. Husband and wife came. I asked, who is she? To the husband. He said, Alzheimer's. She came to my marriage, I think. Headaches. Headache, frontal headache, when wife were outside in the room. Sir, She is the cause for my hatred. Seizures, ischemic stroke, Pitta Pradhanya Pakshavatam. That is why in Manjishtali Pakshavatam is mentioned. Manjishtali Pakshavatam is mentioned. Psychosis, meningitis, Sannibadha Jwaram, meningitis, Sannibadha Jwaram, encephalitis, Pitta Jwaram, dengue fever, Vadabasma, Vada Unmadam, anxiety, neurosis, Pittam, bipolar, type 1 mania, Kapham, depression, Sannibadha, schizoaffective disorder, doubt. I have a Lewy body dementia. Unmadis are contraindicated for Vasti. Next. Renal complaints. After I am going to talk kidney. Next. Original kidney. Leukopenia. Next. C-reactive protein will be high. Kidney liver function, anticoagulant, proteinuria will be there. Next, ANA. 20% is RANA positive. Next. ANA profile. Smith antibody. Sjogren syndrome. Next. Polymyositis, proximal muscle weakness with elevated CPK, LDH. You take the MRI of the thigh. Inclusion body myositis. Scleroderma, no cure. Only talking. AMA, primary biliary cirrhosis. In liver diseases, Vata Pitta Kapha classification is not told. I have made Kapha Pradhanya Yakrutrogam, fatty liver, Tippani. Pitta Pradhanya Yakrutrogam, hepatitis, Vasa. Vata Pradhanya Yakrutrogam, cirrhosis, Draksha. Like that. Next. Lupus anticoagulants. Next. Nowadays doing this. Next. Vasculitis. Pitta Pradhanya. Erythema nodosum, small vessel vasculitis. Wegener's granulomatosis. Small vessel vasculitis. Biopsy is needed. Next. PNK, CNK, anti-neutrophilic cytoplasmic antibody. Autoimmune vasculitis. Next. I am the only doctor who is writing PET scan and all, doing EMG. I am criticized for that because I work with close. I don't do, my friends do. People around me are jealous, They cannot criticize on anything. So tell L.Mahadevan is more modern. They have forgotten that I have done tapas in Ayurveda. Morning 2 o'clock I get up. I read Ayurveda, afternoon Siddha, night Harrison, 22 years. There are days where I have not met my wife. Always I sleep with Harrison. Don't mistake me, that's regular. Next. Phospholipid antibody. 20 years I am studying. I am addicted to study. Midnight I wake up my wife and teach her. Why? You hear it? Because nobody is hearing by 2. You hear? First itself told, I will come to Nasi, but I will not come to the class. Oh. Our wife, my friends, auntie took her somewhere. Let her come later. Next. Beta 2 glycoprotein. Next. Coombs test. Hemolytic anemia. Next. Skin biopsy for vasculitis. Not needed. Next. Purpura, Raktabittam, Vasa, Akare Aushadam. Gangrene, Damani Anguli Sandinam Sangojam, Vadavitta Pradhanya Vadaraktam. Case study went on. What to pass? Case study went time will. We reversed one case that I wanted to show. Same thing, nothing new. Next. Puduchiyadi Yavanavasti. Next. Bhargava Rasayanam. Abhaya Amarakasyava. Dharma Rasayanam. Vada. Shavanaprasam. Pitta. Vardhamana Pimpali. Kapha. Valladagam. Kapha. Next. Serum negative arthropathy. If anybody comes to you with seborrhea, red eye, oral ulcer, urethritis, pain in anus, Achilles tendonitis, calcaneal pain, with pain, RA negative, HLA B27 positive, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, Reiter's syndrome, enteropathic arthritis, Behcet's disease, ankylosing spondylitis, like this. Kubjam pankutvamev cha, bahya abhyantara ayamo, prayo snayugalo anilaga, gambhiravaada raktam, kshiravasti, vardhamana vippali, psoriatic arthropathy, balagudu ityadi, kaishora guggulu, madhusnagi churnam, guggulu dittakam snegabanam, virejanam, avastam propya nirdishtam, kushtinam vastikarmaja. Kushta vasti is contraindicated. When avastas are demanding, you can give vasti. Charaga, there is panchadikta vasti for kushta. This last word is from Chakradata vasti jigisa. Next. Ankylose means fusing together. Next. Bony ankylose, bamboo spine appearance. Complete sacroiliac sclerosis. Trikam. Tasna Saptakam, the word trikam is mentioned. Shunti prakshepa. Next. Risk factors. Next. Male predominant disease. Next. What about Mudijidi? Next. Summary I have told. Next disease you go. Rasayanam you? Previous. Where is Rasayanam start? Next. Rasayanam is divided into two. Vyadi utpadaka pratibandhagatvam, vyadi bala virodhitvam. To prevent the disease, to cure the disease. Amalaki you can take, I can take. Triphala you can take, I can take. Tuvarakam I cannot take, you cannot take, patient can take. Vyadi utpadaka pratibandhagatvam, preventive. Vyadi bala virodhitvam, curative. Vyadi utpadaka pratibandhagatvam, immunomodulatory. Vyadi bala virodhitvam, immunosuppressive. There was a competition. Mashaparniyam chapter, one fellow studied in Charaka. Then he invited everybody, allopathy, homeopathy, Ayurveda, bought a cow. We will give. Who is small, white, gave to cow, white balls. They give, no? Good medicine. Take it. He also brought some 5 liters milk. Then our BMS went. 1 hour over, 2 hour over, 1 day over, 2 day over, 3 day over. Then he sweated walking in a small cup. He's walking like, hey BMS, what happened? Mashaparniyam, Mudgaparniyam, Charaga told, milk, go, rasam, madhura rasam, you are giving everything. Why only 1 cup? I was milking a bull. Next. At least laugh, my dear. Can I write a Chakravani commentary for that? Asti, incubation period. Jayade, symptomatology. Vardade, progression. Viparinanade, manifestation. Abadiyade, destruction. Nashyadi, death. Next. Balladagara Sayana, Kapavadagara. Next. We give only 3 grams nowadays. Sahasra Balladagara Mandal, nobody can take. For academic purpose, 1 case we can do. 3 is enough, it gives results. 30 ml morning, 30 ml night for 21 days, followed by Virajana. Next. Balladagam which Guruji Paul Kashaya. Vardhamana Vipali, Kava Pradhanya. Next. Diet actually play a little role in autoimmune. It's not very effective. Kaduamla Lavana Varjita Aharas, Masham Dadi. I don't think little effect. But Ayurveda means you have to check the nadi. One fellow was checking the nadi and he slept. Like that. Doctors left. Then patient wake up. Why are you slept? No. I went to your chakra and I was checking Kundalini. Great. Our people will never accept ignorance. They talk as if they know everything. They tell Charaga is great. You are a scientist. Charaga is great. One part. Charaga is wrong in these areas. Another part. Don't get emotional attachment to the science. Respect, honor it, but criticize is then and there. In Kerala, they do Ashtanga Hridayam, Parayanam, Homam, Bali, Prayachittam, Brahmana Bhojanam. Like Velakka Vachinu was in there. That was a sampradayam. By hearting is needed. I cannot by heart, you by heart. Next. Pippali, Kalkam, Rasayana, only Churnam I am giving. Next. Vardhamana Pippali, they say you should not be taken more than 15 days.
Yes.
It should be mixed with Kimsuka Vatraksharam. It should be given with sheep milk. Why? Pippali is acidic. More than 15 days it will produce metabolic acidosis. To prevent Ksharam and sheep's milk, which is alkaline, is given. See, you have to teach all this. Who is teaching? Next. 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 All these things are by my Guru Jnanananda, Yogananda, Dakshinamurti Swamigal, and my Vidya Guru, Dr. Vaidyanathan Sir. One day Sar was making Pravala Pishti in full moon day. He was quoting slokas, Vesatarangini, Kamadenu, Chakravani, Jalpakalpataru. My Agangara was broken, I cried. I went to him, Sir, I do not know anything. I want to survive in this world. I want to make little money, make little vada, eat and live. I cannot become like you. You are great. Tell me some book which I can read in a simple way and survive. And Sir cried. Mahadevan, what did you ask? Come. What did you ask? How can I survive, sir, by reading simple books? Then he came, we were walking. This fellow is taller. He touched my heart like this. Mahadevan, you don't have to study anything. You don't have to study anything. I have already studied. You just follow me.
Yeah.
I didn't turn right. I didn't turn left. I left the book. I didn't look back. I did Saranagati to his feet. Today I am standing in front of you. Thank you very much. Shall I have to stand or any memento?
Yes, sir. I will request Dr. Birla sir to felicitate Dr. L.Mahadevan sir.